Hello dear friends, welcome to PharmaGrid. Let's begin with today's KAPS recalls discussion. Question number 56. Alcohol withdrawal and dependence are related to the deficiency of which vitamin? The options are vitamin A, thiamine, ascorbic acid and pyridoxine. We know that vitamin A is known as retinol and vitamin B1 is thiamine. Then vitamin C is ascorbic acid and vitamin B6 is pyridoxine. Here the correct answer is option B, that is thiamine. That is, up to 80% of people with an addiction to alcohol develop thiamine deficiency. Heavy alcohol use causes inflammation of the stomach lining and digestive tract, which reduces the body's ability to absorb vitamins. Next question. Trifluridine is useful in the treatment of epithelial keratitis caused by which organism? The options are herpes simplex, Pseudomonas aeruginosa, Staphylococcus aureus, and Clostridium difficile. So here the correct answer is option A, that is herpes simplex. Epithelial keratitis is an ophthalmic disorder caused by the action of herpes simplex virus. Trifluridine blocks herpes simplex virus reproduction and thereby helps to control this condition. Trifluridine is a fluorinated pyrimidine nucleoside analog that is structurally similar to thymidine. Trifluridine is active against herpes simplex virus 1, herpes simplex virus 2 and vaccinia virus. It is indicated for the treatment of HSV keratoconjunctivitis and recurrent epithelial keratitis. Because the triphosphate form of trifluridine can also incorporate to some degree into cellular DNA, the drug is too toxic for systemic use. Therefore, use of trifluridine is restricted to a topical ophthalmic preparation. Next question. Gingival hyperplasia, hirsutism and ataxia are adverse effects associated with the use of. Options are minoxidil, phenytoin, ginseng root and chlorpromazine. Here the correct answer is option B, that is phenytoin. We know that phenytoin is an anti-epileptic drug. It exhibits saturable enzyme metabolism resulting in non-linear pharmacokinetic properties, which means small increases in the daily dose can produce large increases in plasma concentration resulting in drug-induced toxicity. Depression of the CNS occurs particularly in the cerebellum and vestibular system, causing nystagmus and ataxia. Ataxia describes poor muscle control that causes clumsy movements. The elderly are highly susceptible to this effect. Gingival hyperplasia may cause the gums to grow over the teeth. Long-term use may lead to development of peripheral neuropathies and osteoporosis. Because of the high frequency of adverse effects associated with the use of this drug, patients must be monitored closely during therapy. Question number 59. Danazol can best be classified as an. The options are androgen, estrogen, progestin, neuromuscular blocking agent. Here the correct answer is option A, that is androgen. Danazol is a weak androgen. It is used in the treatment of endometriosis and fibrocystic breast disease. Next question. The primary function of simethicone in antacid products is to act as an. The options are suspending agent, adsorbent, buffer, antiflatulent. Here the correct answer is option D, that is antiflatulent. What is simethicone? Simethicone is a mixture of inert silicon polymers. It is employed as an ingredient in antacid products because of its deforming action in the GI tract. It acts to reduce the surface tension of gas bubbles, thereby causing them to break and release their entrapped gases. So with this question, we have completed today's recalls discussion. Thank you for watching this video. Have a good day and let's see you in the next video.